Did you know that on the NCLEX, most mistakes in shock questions don't happen because students don't know the definition, but because they fail to recognize early signs or don't make the correct nursing decisions on time? Today, we're going to talk about shock, but not in a purely theoretical way. We're going to approach it the way the NCLEX expects you to think, identifying subtle changes, setting priorities, and acting quickly. First, let's understand something very important. Shock is a condition in which tissues do not receive enough oxygen. And here is a key NCLEX phrase. Shock does not start with hypotension. It starts with compensatory mechanisms. That's why many NCLEX questions describe a patient with a normal blood pressure, but something is already wrong. When the body enters shock, it tries to survive. Heart rate increases, blood is redirected to vital organs, and metabolic changes. All of this happens before the blood pressure drops. For the NCLEX, shock is divided into four main types: hypovolemic, cardiogenic, distributive, and obstructive. Let's go through each one, always thinking like nurses. Let's start with hypovolemic shock. Here, the problem is clear. There is not enough volume. This can be caused by bleeding, dehydration, burns, vomiting, or severe diarrhea. So what do you see first? Not hypotension. The early signs are tachycardia, cold and pale skin, dilated capillary refill, and decreases urine output and restlessness or anxiety. Now think anklets. What do you do first? You place the patient in a supine position, administer oxygen, obtain large bore IV access, and start rapid fluid replacement. In this case, you don't start with vasopressors. First, you restore volume. Now let's move on the cardiogenic check. Here, volume is present, but the heart cannot pump effectively. This usually occurs after a myocardial infarction, in severe heart failure, or with life-threatening arrhythmias. The patient is typically hypotensive, with respiratory distress, crackles, jugular vein distension, and decreased urine output. And here is a classic NCLEX trap. If you give aggressive fluids without proper assessment, you will worsen the patient's condition. Nursing priorities include oxygen administration, continuous cardiac monitoring, avoiding fluid overload, and administering inotropic medication as prescribed. Now let's talk about distributive shock, which includes septic, anaphylactic, and neurogenic shock. Let's start with septic shock. This occurs due to a severe systemic inflammatory response to infection. Early on, the patient may have fever, tachycardia, rapid breathing, and something very important, the skin may be warm and flushed. This is a key NCLEX point. Early septic shock is warm, not cold. As a nurse, what do you do? Provide oxygen, obtain cultures before antibiotics, start broad spectrum IV antibiotics, administer aggressive IV fluids, and monitor lactate levels. Now, let's move to anaphylactic shock. Here, there is no time to hesitate. It occurs after exposure to an allergen and can progress very quickly. You may see facial or airway edema, hives, respiratory distress, or a hypotension. The absolute priority is the airway, and the key intervention is immediate intramuscular epinephrine. Then, oxygen, IV fluids, and additional medications follow. On the NCLEX, you don't wait for orders when the airway is at risk. Next is neurogenic shock, which occurs after a spinal cord injury or a spinal anesthesia. This type has a combination you must memorize: hypotension with bradycardia, along with warm and dry skin. If you see this combination, you should immediately think of neurogenic shock. Nursing actions include maintaining body temperature, administering fluids cautiously, and using vasopressor as indicated. Finally, we have obstructive shock. Here, something is physically blocking blood flow, such as a tension pneumothorax, cardiac tamponade, or a massive pulmonary embolism. The patient presents with severe dyspnea, sudden hypotension, jugular vein distension, and chest pain. The priority is oxygen and immediate preparation for urgent intervention. Before we finish, let's briefly review the stages of shock, because the NCLEX love this topic. First is the compensated stage. Blood pressure can be normal, but tachycardia and anxiety are present. Next is the progressive stage. where hypotension and altered mental status develop. And finally, the reversible stage with multi-organ failure. Remember this, the NCLEX doesn't want you to reach the reversible stage. It wants to know if you can recognize shock while it is still compensated. And here is the golden rule for any NCLEX shock question. Accident first, perfusion second, and cause third. Always ask yourself, is the patient breathing? Are they perfusion? What type of shock is this? If this content helped you, I invite you to join the Enfermeras and USA, where we guide you step by step through your NCLEX preparation. Don't forget to save and share this video and follow us on all platforms for more high yield content that truly appears on the exam. See you in the next class.